Thanks very much, Nico. And thanks to the Roundtable for having me here today. I know the Roundtable has heard a lot already about systems approaches and their application to obesity. I'm going to add my own voice to this chorus, but I'd also like to talk about the practical challenges of modeling and give my opinion on some things. These opinions come from 40 years of doing system dynamics modeling, including 30 years as a consultant and 20 years working in public health specifically. Okay, so the committee has asked if I could cover a number of topics, even more than you see here. And while I won't be able to do justice to everything, I'll do what I can on these 6 topics, which are requirements for a useful and reliable systems model, the role of qualitative mapping and group model building, the idea of levels of evidence and what I'm calling the possibility frontier, and also the question of whether big data, analytics, artificial intelligence could help. The notion that when it comes to obesity modeling and other public health modeling, different issues call for different models. I also want to talk about modeling equity and social justice with a small example, and talk about the elements of effective modeling projects, especially large modeling projects. So clients come to me hoping for a way to make better decisions that will stand the test of time. They want to avoid the errors of looking only where the light is and short-term expediency making things worse in the longer term. But how can models do this reliably when there are so many uncertainties in social systems? These are uncertainties that make it impossible to forecast with much precision. Now, we know George Box's famous quote, "All models are wrong, but some are useful." But, I was thinking about what does that really mean? To me, it points to a key characteristic of good, useful models, which is that they can get the intervention impacts correct and be useful for decision-making, even if the baseline predictions are imprecise, even if they are not forecasting tools, they can still be good decision-making tools. We test this sometimes with sensitivity testing to determine just how much confidence we can have in our result, but often we find that our results, our policy conclusions are robust, even though we don't do point prediction. So when I talk about systems models, I'm thinking of 3 or 4 main types that you see here: system dynamics, discrete event simulation, microsimulation, agent-based models. These were all mentioned along with Markov chains, which sort of fit in here as well, in an article by David Levy and Associates in 2010 called Simulation Models of Obesity, a Review of the Literature. So these techniques vary in terms of their level of analysis, their time horizon, their approach to heterogeneity of individuals, their approach to uncertainty, how long it takes to run a single simulation even. Every technique has its strengths and its limitations. I happen to concentrate on system dynamics, which emphasizes compartments, which is categories of individuals rather than each individual, stock flow cascades, feedback loops, and a longer time horizon, often a time horizon of years or even decades. But I would say that regardless of technique, all of these modeling approaches agree on one thing, which is that models should be testable, focused, and developed scientifically. This is a running theme in my work. I've implored my colleagues in system dynamics to take such a scientific approach. But before saying more about systems models, I want to say something about systems diagrams or maps. So I'm contrasting models and maps, models being the things that are quantitative and that you can simulate. A map is a picture, and it can be useful, but it has its limitations. Here we have the Foresight UK obesity system map from 2008 that many of you have seen. So this has some of the characteristics of a systems approach because it's expansive and it's causal. There are lots of variables here linked together by arrows and some feedback loops. But it is not really problem focused. It's untestable as well. It's not quantified. And if I left my clients with only this map at the end of a project, they would refuse to pay me. It would not help them solve their problems and their dilemmas. In that sense, it's not problem focused. So I am aware, of course, that the Roundtable has been involved in a process of qualitative mapping and group model building this past year. Group model building was first developed in the late 1980s by modelers in the United States and in the Netherlands as a way of bringing more stakeholders into the modeling process. That's a good thing. We've had a healthy debate on this subject for more than 20 years, and I've been involved in that debate. Nobody questions that maps and group modeling have value, but the question is how far one should take them. And even people who are new to the idea of systems modeling should be aware of this debate, I think. So these three quotes are representative. They start with one by Eric Wolstenholme, who was an early proponent of qualitative mapping, who said that qualitative mapping introduces circular causality and provides a medium by which people can externalize mental models and assumptions and enrich these by sharing them. A couple of years later, I and my colleague Rogelio Oliva entered the arena and said, well, we agree that system description through mapping can be a useful activity. It improves the process of thinking about the structure underlying a problem. However, maps are notoriously unreliable tools for behavioral inference. Only through formal testing can one solidly bridge the gap from structure to behavior. Much more recently, there's a quote from George Richardson, who I interviewed, looking back on his work in group model building. He's one of the originators of group modeling, and he had this to say: participatory or group modeling was created to enrich and strengthen the modeling process, not to water it down or simplify it. It wasn't supposed to be a way to shortcut the hard work of modeling, nor to open the door to using maps instead of testable quantitative models. So the rest of my talk is about quantified simulation models and practical considerations for their reliability. And I'm going to start with a couple of conceptual diagrams that describe what can be accomplished and the effort that's required to get there. I call this the possibility frontier. We have a y-axis, which is breadth, from very narrow to very broad. That is the number of concepts in the model, sort of separate concepts in the model. The x-axis here is the level of detail. How many subcategories are there per concept? So not much detail all the way to very disaggregated. So here the dotted line is the possibility frontier, and beyond that possibility frontier lies what we call the black box area. These models are very broad and very detailed. They end up being limited by data and by our ability to understand them. So they end up being too hard to validate and, in a sense, are impossible from a reliability standpoint. Within the possibility frontier, though, there are a few different ways to go. One can model something with a lot of concepts but not much detail, and that might be characterized as general theory. That has its place. Decision makers maybe not so interested in that, but this is an important sort of place to start. At the other end of the spectrum are models that are very narrow in terms of the number of concepts, but very disaggregated, so that you can see many subpopulations and subgroups. And this helps us understand patterns of disparity, but not so much the interactions of different forces. So this can also be useful to decision makers so that they can understand patterns of disparity. But I like to model sort of in what I call the policy sweet spot, where there's enough detail and enough breadth to be useful for decision makers. And I'm guided toward that policy sweet spot by the decision makers that I work with. Here's another kind of conceptual diagram, which appeared in an article of mine about how to assess a model's level of evidence. This idea of level of evidence is borrowed from the biomedical sciences. It's used broadly as a way of rating studies as low, C, B, or A level of evidence. And the idea of this graphic is to say that the broader your scope, the y-axis on our previous graphic, the longer it will take you to get to a high level of evidence, or we could say reliability. So what could be days or weeks for a narrow model might take months or years to get to a high level of evidence for a broader model. So you might ask at this point, now we're in the era of artificial intelligence and machine learning. Could it speed this process so that even a broad model could be developed more quickly? And I would say one answer to that is sure. Machine learning helps us search widely in large databases for statistical regularities, and that's a good thing. But correctly inferring causation from these statistical regularities is something else. It seems unlikely to me that artificial intelligence can bridge that gap, and also that it can bridge the gap that we always grapple with, which is incomplete data and different data sets that don't mesh together. So if automation cannot overcome these basic gaps, then we're going to have to continue grappling with them as people. Science will continue to be a back and forth between hypothesis and data and the need for parsimony. This is also known as Occam's razor, or as Albert Einstein said, as simple as possible, but no simpler. This seems to me an inherently human judgment. A talk on obesity modeling would not be complete without showing an actual obesity model, or at least a schematic of one. So this diagram shows the essence of a system dynamics model that we developed with the CDC's Division of Nutrition, Physical Activity, and Obesity back in 2005. It depicts a cascade in which caloric imbalances translate to changes in weight and then changes in BMI categories up and down this chain. And the population here was the national population broken out by sex and also by single age cohorts. These cohorts, the logic of it is that at the end of each year, any change in weight is then carried over to the next year, and it allows you to see patterns of change by age category. This model made use of longitudinal data from over 30 years from the NHANES National Survey and also from the census. And importantly, it also incorporated the information available at that time from NHANES on 1 year weight changes that were occurring up and down in adults, and from the Arkansas School K-12 assessment from 2004 to 2005 that looked at something similar in kids and how their weight was going up and down. And this allowed us to get a better handle on these up and down flow rates. So what was interesting about this model is that it allowed us to consider preventive interventions for people of all ages or for people of specific ages. And it also allowed us to look at effective weight loss programs for people with obesity. So the model was obviously simplified in lots of ways. It didn't consider any of those feedback loops that you saw on the Foresight UK map, but it did address some interesting questions in what I would claim as a focused way with a high level of evidence. The findings you might not find earth-shattering, but they were a fairly confident step forward, and given the data that we had at the time. I want to list these findings, which still to this day I think are pretty striking. The first one is that the caloric imbalance is responsible for the increase in prevalence of obesity from 1970 to the 2000s was only about 1 or 2%, that is less than 50 calories per day within any of the age, sex, and BMI categories. It's not as big as you might have thought. Second, the impacts of changing environments on adult obesity take decades to play out fully through the aging structure or the carryover effect from one age group to the next. So it could be that interventions on the preventive side would take more years than you might expect. Third, we concluded that youth interventions would likely have relatively small impact on future adult obesity. This did rely on the information we had from that Arkansas survey that showed that young people go up and down in weight quite a bit, and in many cases grow out of their overweight condition by the time they're adults. Finally, we concluded, after much testing, that the ideal policy would combine preventive interventions with effective weight loss options for people with obesity. So whatever you think of those conclusions, it's interesting to note that others then and since have done similar explorations of BMI transitions and caloric imbalance. Claire Wang and Steve Gortmaker at Harvard were taking a counterfactual statistical approach at about the same time we did this system dynamics model, and they reached similar conclusions on caloric imbalances. I think researchers should use whatever modeling technique they find useful, as long as it gives reliable answers that can help decision makers. There are, of course, many other issues connected with obesity, and no single model can address all of them. Since 2005, several system dynamics models, and these are the kinds of models I'm familiar with, have addressed or touched on obesity, and this list gives you some idea of the range of topics. There was an individualized weight management strategy that focuses not on a population, but just an individual. There's a food market transformation model that looks at unhealthy food and healthy food sort of in competition with one another. There's a model of diabetes onset and progression and how it's affected by obesity. That was done at the CDC. Another CDC model looked at cardiovascular disease and obesity as part of a causal chain that goes from modifiable risk factors, including physical activity, nutrition, other diet components, to hypertension, hyperlipidemia, diabetes, and cardiovascular disease ultimately. And one other more recent model included population obesity as part of a causal chain from a variety of social determinants of health, including things like housing and transportation and crime, to overall morbidity and mortality at a county level. So obesity was one element among many in that causal chain. This gives you some idea of sort of how obesity can either be the focus or a portion of a dynamic systems model. So none of the models that I've mentioned, though, focuses directly on equity and social justice. I haven't seen such a model that yes, you can break a population out by race or class or gender to describe the differences, as I said, to describe disparities, and to project, you could even project the impacts of targeting interventions to one subgroup or another. But that's not the same as really having a focus on equity and social justice. So I think we can get there. I think we're not there yet. But what it would take is maybe something like this, a model of the social forces that reinforce inequity and undermine justice, and look for ways to reverse those forces and turn vicious cycles into virtuous ones. So what we have here is a high-level model of how a community responds to a shock like COVID that can exacerbate adverse conditions, or what the Gallup Well-Being Survey calls struggling and suffering, which you see over here in the diagram. They actually measure these things. And so you can think of this as a model of a community's resilience or its ability to rebound. This takes off from a framework developed by the CDC and for their Healthy People 2030, a well-being framework that mentions many of these concepts and starts to think about operationalizing them. So equity, this framework includes concepts like vital conditions, of which obesity is one, urgent services capacity for the poor, for the homeless, in terms of law enforcement, the idea of civic muscle or civic capacity, and also the idea of equity. And in this initial framework, which we've converted into a simulation model, decisions have to be made about how you allocate your civic muscle or your ability to react to shocks, and that has effects over time. So here's a shock, and this is just one representative output from the model showing these different variables. So here's a shock in which we have not done a very good job by the end of 12 years at regaining the former equity that we had, even if that wasn't perfect, because we prioritized other things. This is just one kind of output that we see from this model. It's suggestive, it's thought-provoking, but I would characterize this as exploratory, or even call it a toy. We will not, and we need something to get to a more serious tool. So what that would be is case studies of particular places, longitudinal data that would help us operationalize some of these concepts. I wouldn't go to decision makers yet with this, except maybe a few to get their initial reactions. But this is not ready for prime time. It's just a first step. Several key parameters were estimated roughly, so I think this is just a first step. And in contrast is my final slide here, which talks about an ideal project which is well-funded, that goes for more than a year. And the reason that I end with this slide is that the Roundtable Committee had asked, when I spoke with them, about how best to approach systems modeling with respect to a number of things: project design, partnerships, communications, training, and so forth. And so I said, well, maybe I can just think about, look back on my all the projects I've been involved in, and some of those were effective and influential, and others less so. So what were the common characteristics that I can pull out of this experience? So here are my thoughts about what it takes. So first, the idea of following best practices for building, testing, and documentation of models. So the aha here, I think, is that those best practices do exist. I'm not saying that everybody agrees on them, but there are publications about how to do systems modeling, how to report outputs from systems modeling, and document the models so that others can replicate them and verify them. Second, I believe that good influential models, reliable models, should be anchored to well-established data sets like NHANES, like BRFSS at the national level, and also the best studies. But I found that having sort of a core of longitudinal data that are well accepted is important for gaining respect and credibility for your efforts. I would say that, like any social science work, it's important to have data analysts that can extract data and statisticians that can help you to interpret it properly. I also think that on the team you need stakeholders, decision makers, and subject matter experts as advisors. I'm not saying that they need to work with you every day during the project, but you should be meeting fairly frequently with these folks so that you stay on track and that the model is reflecting their concerns and their knowledge. From the standpoint of ultimately disseminating the work, I think it's important to keep other thought leaders in the loop, thought leaders around the country and around the world, who can be your allies ultimately in working with decision makers. And finally, there's this question of what to do with junior modelers, because it's my belief that fresh out of a graduate program, you're not really ready to lead such a large modeling project, maybe a smaller one, but not a large one that has so many moving pieces. But I think junior modelers, like any other professionals, need to get experience beyond their graduate studies in the form of a mentorship and as part of a project. I've had very good experiences working with junior modelers as apprentices who then go on to do great work on their own. So with that, I just want to thank you very much for your attention and ask you to enjoy the rest of the workshop today. Thanks very much.